Hello, Rodrigo.
Hello.
How are you?
Very well. Thank you for having me.
Thank you. Thank you for coming here to this interview. This is for our effective leadership class at Johns Hopkins Carey Business School.
Great. I'm happy to be here.
Great. Rodrigo comes with us with experience of leadership in Baltimore Hospital as a clinical care manager. And now he has moved on since he has graduated from Carey Business School, and now he has a patient access manager working at Suburban Hospital here in Bethesda. Welcome, Rodrigo.
Thank you. Thank you. I'm glad
So,
to be here.
so today we're going to speak about leadership and what you have done and what you have learned about leadership in both hospitals. So tell us a little bit about your experience and what have you learned about leadership styles.
Well, first of all, I was working in Baltimore and Johns Hopkins Hospital for about 6 years. And here I learned how to lead in a large corporation, obviously vertically and horizontally, learning to speak and effectively communicate with directors, managers, and not only with the corporate world, but also the clinical setting, which I wasn't exposed before, such as nursing, doctors, attendings, residents, and also patients and patient family members, who were the most important stakeholders of my job. So in a nutshell, this is what I learned. For about a year I was the new guy, but then later on and moving forward, I learned how to engage and motivate my staff. I was in charge of only 10 employees, but it was a good team, and we were always motivated, and we were always working in support of the clinical team. So after that, I moved forward to here, Suburban Hospital, and now I am...
After graduating from Carey.
Then after, while I was in Johns Hopkins Hospital, I graduated with an MBA from Carey Business School, and shortly after I moved to Bethesda, where I currently reside, and I got a job here as a patient access manager for the Department of Patient Access. And this is a department that is divided into two sections: the revenue cycle management and the patient registration portion of it. So now I'm in charge of 42 employees. So it has grown exponentially. I am required to speak and communicate a lot more effectively, of course, and being charismatic. It helps engaging the team and keep them motivated in order to perform well and stay happy. I mean, intrinsically happy.
What would you say would be the difference between, because you have more staff here now at Suburban, and you have less people in charge at Baltimore.
That is
Is
correct.
there any difference between how you would approach your staff? Is there, because you were talking about you have different levels of staff. You have nurses, clinical managers at Baltimore Hospital.
Correct.
But are you dealing with the same customers here, the same
Stakeholders. I would say it's a bit different because I no longer deal with so many patients and patient family members, due to the fact that before I was a part of the inpatient unit team. So I follow through the entire length of stay for a patient, and I will get involved with the patient family members. So it was more engaging, and it would be a different approach for in that matter. But here, what we do is we register the patients, and we are in charge of identifying the patient and not making mistakes on putting the right information in terms of insurance and how the billing process is going to be. So it's a different approach, and it's a much larger team. So my approach is in terms of very transactional and operational, and therefore if anything comes back as a as a negative experience or so, I fix it right away. But I do not have as many moments to fix something if I'm not present, or if I don't solve it right away. As opposed as in Baltimore, I would see the same patient for a week or 3 days at a minimum, or maybe a month. So I would have many chances, and it would.
How would you say you would empower your people here, the staff that you have, 42 people at Suburban? How do you empower them every day? What do you tell them as to motivate them for their daily activities?
Yeah, absolutely. So I speak with them in different levels. Of course, we have 3 tiers. The bed control being the leadership position, and then the full-time registrars who are here committed as a full team, and then the PRNs who come here probably 2 or 3 times every 2 weeks. So my approach is different to all of them, and of course within these 3 groups I identify my champions, and I give them basically I empower them to make decisions, and as long as they share with me, whether later or during the time. But I have had great experiences with them. They're all professionals. They've been doing the same job for the past 10 years. Most of them, they've been here for 10 years, and so I empower them in a way that they feel that I don't micromanage them. I give them their choice of solving the problem, because I am the new guy in the team. I've been in this position for the past 6 months. So I am coming to learn what patient access is. I just happen to have the transferable skills of being a manager, and I've been a manager for over a couple of decades.
Okay, very good. So now we're gonna talk about leadership styles of Redonda Miller, the president at Johns Hopkins Hospital, and how that it relates to your leadership here as well. Now, one of the things that Redonda Miller said, that her mission and what she cares about is patient care and patient experience.
Yeah.
And I think you have that experience from Baltimore Hospital. It's probably the same. So she says that we take care of patients before, during, and after discharge. Tell us about that and your experience about that too.
Yeah, I can tell you that a patient experience can make or break somebody's total outlook of
the
trust.
Hospital.
Yeah, and trust. I mean, first of all, you're coming here, very vulnerable and in a state of distress. So the first thing that you have to do is engage them in a trustworthy manner. So it is the very first impression. You give them trust. You speak with them in a sense of you want to know what their needs are and what immediately can you do for them. Always following protocol and policy. And then during the experience, you get to know them. You have several chances to getting to know them, because you come to their rooms and you speak with them in a pleasant manner where they put their guards down because they are already stressed out and vulnerable. So with that said, you share that with your close team, and the same approach has to be implemented every time, every visit that you go into the room. Of course, always respecting their privacy and
being polite.
Yeah, besides being polite and all that, respecting their privacy, and always being very careful, not to crack any unwanted jokes. Let's put it that way.
Okay.
Yeah, and then after the fact is that when the discharge planning comes along with a case manager and the social worker, you make sure that everything is in place and everything is tied up together, so they go safe and happy.
Very good.
To the house.
Very good. Now, the second thing that Redonda, the second mission and statement that Redonda cares about is focusing in the values of the employees.
Yeah.
Because what we talked about is the patients.
Yeah.
Now the other side is the employees, your team. And she says that in order to have a very good team of employees, you're supposed to work like a team sport.
Yeah.
That everyone is accounted for from doctors, nurses, and all the staff.
Absolutely.
So that's one of the approaches of Rodrigo Miller. What do you think?
Yeah, I think that is actually the most important value, because if you don't have a team, you have nothing. You can be an excellent in patient experience or patient care. We're a world-class organization, but if you don't have a strong and accountable team, you have absolutely nothing. So in a way, you have to make sure that everyone is doing their job. Having said that, you have provided all the tools and all the resources for them to do their job effectively. That is the most important role of a manager, to provide the resources for every individual according to their needs, because some of the employees have different needs than others. So you have to know your team, you have to know your employees, and work together, always partner up. So empower them, give them the resources, and follow through. Always trust.
Very good. That's a very good approach. Follow through, and give them the resources so that they can solve the problems that they need.
That is right.
And then the third one and last one that Redonda cares about, and her mission and her statement is caring about the community, to continue being a global leader. Right. Meaning that she focuses on the community around the hospital in order to provide, number one, population health, right, and wellness and prevention. I think that could be shared all around all hospitals.
Right.
What do you have to say about that?
Well, that is actually something that I have not experienced so much, because I've been working in the clinical setting first, and now that I'm being exposed a little more. So I joined the Hopkins Familia. We actually co-chair this Hopkins Familia for Latinos in the health system, and we get to know the people that we impact around our community. And so it's very important for the global wellness in order to educate all our patients and even our co-workers that vaccines do work, and we are in charge of the vaccine clinic and the testing site for COVID. So this is crucial. And testing at vaccine times, we used to vaccine 400 patients a day. And so this is a major operation. We are in charge of a 24/7 operation in the ED, but here you can see that we make an impact here on people, and it's very important that we keep educating our community. We serve our community, and we see the same people quite often sometimes. So it is all about education and following through.
Education. Yeah. Educating the community so that they can take care of themselves as too.
Absolutely. Yeah.
Okay, very good. So those were the three mission statements that Redonda Miller cares about, and I think you shared that with her on the Baltimore Hospital and Johns Hopkins Hospital community here. Now we're going to talk about Johns Hopkins, but not the university or any of the divisions. We're going to talk about Johns Hopkins, the man, the founder of the institution, and his leadership.
Right.
I know just a little bit about him. I would come and comment, but tell us about Johns Hopkins. What did he do as a leader to distinguish him from others?
Right, absolutely. Yeah, he's the founding father of this mission, and I actually I was captivated by as I was learning about him. With middle school education or primary education, he became the leader of in so many aspects in the Baltimore area, and he was very savvy with numbers and with in business. And during the wartime, he was in charge. He was left in charge with a store from his uncle, and when his uncle came back from the Civil War, his store was in a surplus, so much that they expanded. So since an early age, he was very, very savvy in business. He had an innate ability to understand and analyze and identify opportunities for growth. So I think that he is an admirable leader in that sense. But most importantly is his humanitarian side of his leadership. And he was not ruthless as most of the entrepreneurs and the leadership requires you to be, but rather he was very humanitarian, and he was he left in charge to a board of trustees to establish a medical institution that will rival the other medical institutions around the world and in Europe. So much so that he brought in a medical doctor from England that he created this board of trustees with a simple mission of taking care of the poor and not charging them if they didn't have any money, and charging the people that had money in order to sustain the operations.
The system, yeah.
Yeah. And the other part of it is that he wanted a research university first in order to learn from all the practices. So that's exactly what he did. He founded the university first, and then 10 years later they founded the
hospital.
The hospital, that's correct.
So basically, based on the university and their research, the university would empower the hospital.
Correct.
All the technologies and the patents developed by the university would empower and lift the Johns Hopkins Hospital and institutions around it.
Yeah, that is correct. And that's admirable because, I mean, I haven't seen or I haven't learned from any other leader that had that vision.
Very good. Now, we spoke together a little while ago, I think three weeks ago, when we celebrated the birthday, that Johns Hopkins had but he was the president of the Baltimore, Ohio Railroad.
Yes, and
I believe he was friends with Peter Cooper, because Peter Cooper had purchased land here in Maryland.
Right.
And they found iron that would sell the iron to the railroad, Baltimore, Ohio Railroad company. So tell us about how that came about, like why he became the president for the Baltimore, Ohio Railroad.
Well, you gotta cut this.
Okay, cut it.
Yeah, because I really